Okay. So, like Shannon said, today we are not here to decide kahan se padna hai, kitna padna hai, where should I get the assessment details from. We are not here for that. We are here to understand how do you approach studying psychodiagnostic assessments for your entrance exams. Okay. So I'm just putting the expectations very, very straight. We are learning how to learn. Okay. So having said that, let's move forward. Basic introduction, I think Shannon has already given it. I currently work as a clinical psychologist. It's been 8 years since I've been doing assessments. So I do know a little bit of how to actually study and apply the understanding of assessments in your day-to-day life, which also means that I have been training students, I have been training early career therapists for their um, therapy journey ahead, how to actually go ahead, do their practice, everything said and done. I have a lot of interest in training students for MPHIL exams. Some of them have gotten into the universities also, so that's really great. One of the things that I have understood as a whole, that there are two spaces where students really, really struggle with entrance exam is research and statistics. And I think you guys have Shannon to help you with that. And the second aspect is assessments. That is what we are going to do today. By the end of the next, I think, 1 hour, we have to understand and get through these three agendas. Okay. The way that we are approaching psychodiagnostic assessment, the mindset shift has to happen of how we are doing it, because currently mugging it, marufying it is not helping. The second thing is, how do we practically link disorders to theories, to tests, to functions? We are going to understand that. And we are going to go through at least 4 examples of MCQ, MPhil level MCQs, which will be broken down to show that even if you haven't technically studied the entire assessment, maybe you don't remember, there is a brain block with so much of information, you will still be able to go ahead and answer the question. Okay. Are you guys with me? Yes? Can I get some thumbs ups? Great, great. So going forward, there are going to be some questions. I would need some interactions, okay? Okay. Quickly write down in your chat box, take like a minute. How do you feel about studying psychological assessment for exams? I'm looking at the answers right now. How do you feel about it? What are some of your experiences? Stressful but fun? What else? Overwhelmed, it's too much to do. I'm excited, clueless, nervous, confusing, lost, complicated, interesting but can't remember, too much information, yes, lost. Okay, what else? So, okay, I like it, the structure can be much, but okay, allows me some organization. It's extremely interesting, but interference is a lot. Interference from what? What is the interference that you're talking about, Divya? Curious, okay. So curious, lost, too much information, overwhelming, motivated, okay. Okay. What is your current experience? I'm sure you guys are preparing. So you must be also reading psychological assessment for exams. I disagree with the idea of assessing people through tests. Unnati will have a discussion post the presentation is done. Information overload. Okay, yes, yes. Do you all agree that there's a lot of information with respect to psychological assessments? Okay. Do you all agree that there is a lot of subtests to remember? Okay. Yes, yes. Can it get extremely confusing when they start asking multiple related questions and then give you random options that you might have not even heard of? Because MPhil level MCQs are difficult. Recently, I was speaking to Shannon and he mentioned that NIMHANS ke exam mein ways Phase 3 had come, but the current version is phase 5 that's been going on, right? So that can get very confusing, right? There is different versions. Everything has different kind of subtests, and we don't know exactly what's been happening. So that comes to my second question. How are you preparing for exams right now? For this chunk? How do you do it? What are some methods you use? What do you do when you say that you're studying for it and you feel difficult? How are you approaching it, right? Do you read the book? Do you read the manual? What do you do? How do you study? Do you Google? Um, Avoid it. Okay. Okay, that's fair. That's also because it's overwhelming. So I completely understand. What else? Use mnemonics to remember chat GPT, of course. Okay, fine, fair. Read the book and then see how it's conducted through videos and stuff. That is really nice, Sarah. That's extremely helpful. Textbook, YouTube, chat, Google. Okay. Master's notes, language text thing now, which is available. Great. Introduction test from my master's, papers, everything that you can find. Okay, Ananya. Okay. Google every test, try to link it to subtest and main rationale of the test. Okay, that's good. Internship notes and mind maps. That's really nice. Textbook, manual, sometimes videos, because it makes it easier to learn with. Okay, okay. Anyone else with any other things apart from what is mentioned? So Google, Chat GPT, master's notes, hyperfixate on the topic, deep research, and then forget. Okay. Case studies, okay, MCQs, PYQs, learn about the options where they are. Okay, okay. Do you all feel that these are scattered strategies? Is it leading to something? Or is it just information, information, information? Very scattered, yes, yes. And it's not leading somewhere, right? Like we don't know what we are studying, why we are studying, how to approach it. How do I remember this? Right? The major aspect of any entrance exam, recall, recognition, elimination, MCQs, right? So if your study method, anything that you use that works for you, is not helping you with recall, recognition, or elimination, you're doing it wrong. Okay, so this is not just for psychological assessment, but this is for any entrance exam, especially more so with MPHIL, because it is impossible for you to cover the entire syllabus because we don't know what the entire syllabus is. Do you agree? Will it ever be possible for you to read everything? Is it possible? Absolutely not. I don't know everything either. Like today, I think you guys might ask me some question, and I am very well equipped to say that I don't know. But I will also say that I will get back and give the answer to Shannon so that he can put it on your group. Okay. So let us have a clean slate and try understanding how can we approach MCQs, how can we approach studying psychological assessments, which can help us recall, recognize, or eliminate. Can we do that today? Yes? Great. So currently, most of the students, like you said, you all are studying extremely hard. The hard work is done, right? But there are some errors in actually preparing. Maybe you are memorizing the subtest in isolation, like just understanding and making mnemonics without actually making sense of it. That brings me to flashcards. There is no context to it. Trying to cover every test, but not understanding what is the core between like what's the core, what is it actually assessing, why am I even reading this, is it even relevant, is it used in India, what is it? And the most done error is reading psychological assessments individually. Understand that your psychiatry, your psychometrics, and your abnormal psychology, which basically means all the disorders, all the ICD DSM criterias, cannot be read separately. That is the most frequent common error. Have you guys done at least one of these in the last month? Okay, good. Keep the thumbs up coming because that's the only thing I can see on the side that you guys are listening. Okay. So, how are we going to approach this today, from today? There are three mental shifts. Shifts meaning there are three perspective changes with respect to approaching psychological assessments that we are going to make, and three action principles that we are going to use for us to do our MCQs better. Okay. When I say three mental shift, we have to understand what is the purpose behind doing a certain test. When I'm doing a neuropsychological assessment or when I'm studying a neuropsychological assessment, why am I even doing this? What is this test meant to assess? Like, for example, have you heard about block design as a subtest? Yes? Okay. Do you know that block design can assess intelligence, neurological damage? It's a neuropsychiatric assessment, right? So, what is the purpose of this test? What does it measure? Okay. So, it has a place in intelligence, it has a place in neuropsych assessment as well. So, understanding the purpose. Asking why more than what. What is the assessment? What is the subtest? We'll come to this later on in the slides ahead. And like I said, we don't have to separate psychiatry, psych testing, and psychology. Okay, can we try to do this from here out now, from today? Can we follow these three things? Is it easy or is it too much to ask? Can we make these mental shifts? Yes? Okay, great. Good. Now, ठीक है, बात तो कर लिया mental shifts के बारे में, but how do we actually put it in action, right? We are going to see everything in action principles with examples so that you understand. Okay. This is going to be more of an understanding sort of a webinar rather than just some word being put in. First, we are going to see the entire picture. We don't start with subtests. We have to understand what does a test measure? What is the overarching understanding of the question? What is the question asking us? Second, what are we assessing? What do we understand by it? And the third, each subtest has a clue. Every element is going to tell you something or another. Okay. Now let's see the most frequently asked doubt that I get on literally every platform that I'm on. We'll start with this one. Okay. I can't remember subtests. Do you guys also face this? Okay. Has any one of you actually, okay, a lot of people, okay, get it. Uh, did you guys give the MPHIL exams? Any NIMHANS to begin with? I think that's the most recent one. So, okay. Yes, there are so many batteries of assessments. Majorly, we'll discuss about something which is more common, which is intelligence, Rorschach. We'll also discuss about Bayes or WISC. Okay. What happens when there are subtests? We get confused. We don't know which subtest is going into which index. We might get extremely overwhelmed with a lot of questions as well, because our visual memory is not our best friend, right? Because so many things are there in visual memory we can't understand. So we don't have to memorize, we have to conceptualize. Okay? What do I mean by conceptualization? Can we take the first example? Yes. Let's take WISC. Have you all known of what WISC is? Do you know what WISC is? Can someone quickly write it in the chat box so that people who don't know don't get overwhelmed if they don't know what WISC is? Can someone write the full form of it in the chat box? Quickly. Wechsler's intelligence scale for children. Good. Thank you. Thank you. Okay. So when we talk about WISC, we know that there are 4 indexes for WISC, right? So WISC measures children's intelligence on the basis of 4 indices, which then gives us a full scale IQ. Yes? Simple? Okay. Now, why does it have 4 indexes? Because it is measuring certain set of um, abilities in certain contexts, in certain bunch of functions, which together when it comes makes us give an intelligence score to a child. Simple conceptualization. Yes. Okay. Now, let's just see what we'll take one example of verbal comprehension index, right? Without even understanding what is the subtest, let's just park it in the bay. Okay. What is verbal comprehension? What is verbal comprehension? Can I say that if I assess verbal comprehension here in today's webinar, I would assume that the verbal comprehension of everyone here is above average, average and above average? Why can I say that? Why will I say that? Because you guys are responding to me. Does that make sense? Yes. So there is some sort of a response that I'm getting. That means, very rightly put, understanding grammar, language, ability to understand written and spoken communication. Very well said, Arima. Right. So when we are talking about verbal comprehension index, also known as VCI, we won't be able to understand this function if we are doing a paper pencil test. We will have to have verbal communication with the client. Yes. Can a paper pencil test help us understand what verbal Yes, exactly. So the major part here is it will have the subtests which measure verbal comprehension, like similarities and vocabulary. Now this, and I will be completely honest, I don't remember all the subtests either. I've been doing this for 8 years now, but I don't. But it's a basic understanding that if it is a verbal comprehension function, it has to measure something which is verbally done, right? So a subtest, even if you don't remember, but you remember in a scattered manner of what it is, you will be able to understand that similarities basically is a test where the client is given 2 words and the client has to say the similarities between those 2 words. That's it. He's able to comprehend my instruction. He's able to think and respond appropriately, and that's how it will be measured. Okay? The same thing is with vocabulary. Do you guys agree? Do you think digit span will come into verbal comprehension? Or coding will come into verbal comprehension index? Or block design? No, because it doesn't. Exactly. So whenever you're reading about subtests, see, conceptualize it and ask yourself the question, what is it and what should ideally come inside it? It's a very simple way to literally do any other test as well, including your NIMHANS neuropsych battery. Okay. So what is the ability being tested? How would this show up in a daily functioning? And how is it different from any other index? That's why I said block design will not come into this. Is this clear of how we conceptualize basic aspects of some tests? Great. Moving on. We are going to see what are we assessing out of this. Similar to what we already discussed, but something which has really helped some of my mentees is actually making a subtest grid for every major assessment. This is something, the next slide is something I would like for you to write down, at least the headings of it, so that whenever you are reading WAIS, WISC, PKT, neuropsych battery, you make this grid for you for recall. Okay, so just write the headings of it. The subtest name, what it measures, what would a certain impairment look like, and in what kind of disorders can we see this. Like, for example, I've taken one from the intelligence test and one, actually both are from intelligence test, but the second one is also majorly seen in neuropsych because you might have neuropsych questions coming up for MPHIL. Okay, so digit span measures working memory. So when someone is having working memory impairment, that person will have trouble holding any sort of information in their short-term memory. Yes. And that is very well seen in clinical manifestations of ADHD, specifically inattention or even anxiety. So that is how you relate to it so that you don't study things in isolation. Am I going fast or are you guys with me? Is the pace okay for you? Okay, thank you. Similarly with block design. Block design, I chose this as an example specifically because it is also there in intelligence, right? But basic aspect, someone who doesn't have spatial arrangement properly, they're not able to keep, especially in SFPT. Do you know what SFPT is? The small intelligence test usually used for um, not a lot of intellectual population to measure intelligence, not really the best one, but that can also measure poor spatial arrangement. So if someone is not, thank you, segment form code test, yes, SFPT. So if someone is not able to arrange it, you can, if no one knows that, please Google it immediately. That is also one of those tests which can help you assess if someone has visuospatial problems. Does it actually come in intelligence test? Yes. Does it come in neuropsych? No. But does it measure the same sort of function? Absolutely yes. Okay. So maybe in your options, block design won't be there, but at least segment form code test might be there. So that means that you would have to sort of see it in a very diverse manner, in a divergent thinking manner. So both of them can actually assess right parietal lobe damage. Okay. So this arrangement for all the tests can really help you because someone in the MCQ question, you might have the test name, they might ask the impairment. They will ask the impairment, they might ask which clinical disorder it is linked with. They might give the clinical disorder, they might ask you which test can measure it, or they might ask a very confusing question involving everything together. Okay, so this basically covers a 360-degree angle of all the ways that you can approach a question related to psychological assessment. How are you guys feeling about this? Quick. Okay. Someone's shocked. I didn't understand that yet. Thank you. Thank you. Someone is shocked. Can that person, Takshi? Okay. By mistake. Okay. Okay. Fine. Not a problem. Okay. We don't have to get scared of this. Okay. All of these things are something that you know of. It's just that वो थोड़ा slotting की जरूरत है ये same चीज की. That is all we are doing, conceptual clarity. Let's move on to the next one quickly. Can we do a small test? Can we all solve an MCQ together to actually understand how to do this? Okay, ready? No one is going to give an answer unless I tell you to. Please do not. Which subtest in WISC-5 is most likely to be impaired in children with inattentive ADHD? Can this be asked in any of the exam? Yes? Okay. Think about it. Do not answer. Have you guys got an answer in your mind? Okay. Can one of you, any one of you unmute Raise your hand and I'll select. And we need to do this quickly. Raise your hand, I'll select who's going to go. Because you will have to give an explanation of why you chose that answer also. Anyone? Guys? Okay, I'll let go of the first one. Next time se kar lenge. Okay? How do we approach this question? When we talk about inattention, what are we measuring? Remember the first thing that we spoke about, what are we measuring? We are measuring inattention. Inattention can be measured by some tests, which in turn measures working memory and processing speed. Does this make sense? If you have to measure inattention, you will have to take a test which measures processing speed and working memory together. Yes? Good. Okay. So block design had gaya, vocabulary had gaya. So we have two things. We have picture span and we have coding, right? Both of them measure both these functions. But here's the catch. There are some things that we need to read properly about a question. The question is, which is the most likely one? Okay. So a lot of people ask me that dono answer correct ho sakta hai because inattention, especially in ADHD, both can be affected and you might see errors in both these tests, subtests when someone is appearing. But it asks about what is most likely affected. Now, coding is something. Have you seen the coding sheet? You know what coding subtest is? Yes. Okay, good. So when you see the coding sheet, you will see that it requires a lot more sustained attention, a lot more visual scanning, hand-eye coordination, and fast bhi karna. There is so many things that are working, right? Now, when you see an ADHD presentation, coding might be a lot more difficult for children as compared to picture span. Do you agree? Right? So in that case, coding becomes an answer. Now I know that this, Shambhavi, no? Yes, no. Shambhavi, just write down your question somewhere. We'll get back to that, okay? So again, this might be a simpler example for me. I think holding the pictures in mind in a correct sequence is more difficult. It is. But at the same time, when you're talking about coding, there are three functions needing to work together. Okay, like I said, sustained attention, hand-eye coordination, not to make errors, and do it in speed. All four working will be way more impaired, even though both the tests can be used to measure inattention. What is it most likely to be impaired? Because pictures in mind, we don't think people with inattention might necessarily have problems with memory all the time. They might actually be good with visual memory also. But with so many cognitive and executive functions coming together, it can get difficult. It does get progressively difficult, but more impairment is seen in coding. We'll come to that. It's a very good question. I will take that at the end of the webinar for sure. But this example, even though it's simple and a lot of people can answer this question correctly, the point here is there are minute details of how to answer an MCQ. That is what is being pointed out here. Are you guys with me? Yes. For whatever reason, if someone has not studied WISC, imagine you have not studied WISC, but you would have to at least know which test can measure what. Simple, very frequent questions. Like I said, recall, recognition, elimination. If one doesn't work, the others have to work. Okay. I will come to your questions, Shambhavi, at the end. Okay. Now let's go on to something else. We will see how, okay, let's see, don't separate. How do we integrate a lot of different elements of psychiatry, abnormal psychology, and testing together? Can we see that? Let's like, this is something which a lot of people get wrong. Okay? Because you need to know more than just the assessment most of the time. Like, for example, the ADHD thing, right? You needed to understand what ADHD looks like clinically, how it affects the brain functions, and how those difficulties can show up in a test. Am I saying that picture span will not have an error? It will have an error, but most likely, most easily, you will be able to catch up in coding itself. And that's why I said we don't have to separate psychiatry, psychology, and tests. They are not three different subjects, even though they are slotted as three different subjects, but then they are all going towards like one thing. So a disorder like ADHD is not just a theory. We have to see it as a diagnostic measure. We have to see brain function. We have to see test performance. We have to see clinical manifestation. So one advice that I give everyone is studying, whenever you're studying a disorder from ICD, do that disorder completely. Like, do it from Ahuja also, do it from ICD also, read the psychological theories also, do the tests also, and then finish it off. Because that is when the retention is way more, and that's how you prepare. Okay, let's see a different example. I'll give a minute so that you can read this. Don't answer, please don't answer. Give me a thumbs up once you have read it. Okay. Now, very, very honest answer I want. Okay. Have you guys retained all information of the XNR coding system of Raksha? Okay. Okay, fine. Is it, my next question is coming up. Is it easy for us to remember it? Okay. So, if such a question comes, how do you answer? Can we look at this? Can we approach this now? Okay. A 30-year-old with persistent low mode social withdrawal was administered Rorschach blot test. Okay, so we have two clues which we know of. Like, probably this person they are talking about is depression. Yes, can we? Simple. Now we have to understand what is the pattern of response. Understand what is the pattern of response. That means there is a lot of things coming very frequently so that we can pick it up, right? With this kind of a presentation, even if you don't know what movement responses is, you don't know what color responses is, we can always go ahead and think that, okay, this person is having depressive symptoms. This person is having withdrawal. There's a high chance this person is tired. The mind is gloomy. Probably the most frequently seen depressive symptom is of melancholia. Okay, fine. So that person might not be very active. So animal responses, movement responses, a high number of them can be very easily seen in manic or bipolar patients. Okay. So first option to gaya. Rich color responses. A person who is having have you seen or heard something like a dark gloomy cloud on my head? I'm having clouding. I feel everything is dark. These are some responses that you get from someone who is having persistent low mood, right? For such a person, giving rich colored responses will be difficult. Active engagement will be difficult. That person is, we have seen that withdrawal is there. Second option gone. We are left with two options now. If there are no colored responses, their movement responses are not going to be there. So the option which is left for us is frequent achromatic responses. Achromatic responses is black and white responses will be a lot more than a person taking up color from the card, even when the cards are colored. Rorschach has colored cards, yes. You will also see that in presentation with depression, even colored cards have been given non-colored responses. It is okay if you don't know the test. It is impossible for you to remember so much of information. But like I said, recall, recognition, elimination. Use any one of this with your existing information, and you will be able to at least zero down on some answers which seem or might be most likely correct. Are you with me? Okay. Most I will answer Arima's question because it's with relation to this particular question. Yes, it will be mostly asked with respect to EXNER coding system because MPHIL will teach you EXNER. If they have to ask Beck and Cloffer, they might ask not regarding to coding as such. They might ask differences in between the systems. What is more why did EXNER, how is EXNER system different from Beck's and Cloffer, things like that. But with respect to coding and response specific questions, they will not ask you more. They will ask EXNER more. Okay? Yes. Is this clear of how we integrate psychiatry, psychology with your assessment? Okay. So study it together because that will be more helpful for you. Can we take one more question? Yes. Do you know what TBI is? What is TBI? Traumatic brain injury. Yes. Yes. Read the question. Once you're done reading the question, give me a thumbs up. Ideally, for TBI, we should use neuropsych assessment. No? Why are we using intelligence? Good question to think about. Everyone has done reading the question. Go ahead, use the chat for the answers. Whoever is ready. Okay. Again, don't get overwhelmed. We are trying to learn, okay? Even if the answers are wrong, it's fine. Doesn't matter. If you feel that the answer is something else, write that down. I would rather have you a wrong answer. Okay. A lot of people are saying D. Okay. Sarah, give me one answer. Give me one answer. Okay. Okay. Give me a thumbs up if this is a little confusing. Can we go ahead and solve this together? Yes? Quickly? Okay. What information do we have? What is it assessing? It is assessing cognitive ability of a person who has a TBI. Clear? That question is done. Second, there is some information and we need to see what function is it assessing. Function, what is it measuring? Similarities. What does it measure? You just saw it. Use your chat. What does similarities measure? What function does similarities measure? Verbal comprehension, right? Great. Next, block design. Quick, quick, quick. Yes. Arithmetic. Which function? Arithmetic is not math. Math is not a function. Working memory. Yes. Symbol search. Symbol search is speed. Okay. Processing speed. Yes. Is this clear? Do we know this information? Don't look at the answers right now. We are just with the question right now. Okay. So we know that block design, no, sorry, similarities is low. Similarities measures verbal comprehension. Which function, which area of the brain is with relation to verbal comprehension? Wernicke is okay. Left temporal. Okay. Okay, we'll come to that. Block design is average, which means visuospatial function is more so intact. Yes? Let's not go to the options as of yet, guys. No options. We are just talking about the question. If block design, which measures visuospatial capacity, is intact, visuospatial capacity, the area which is responsible for that is parietal lobe. If that is the case, all the options with parietal lobe damage gets out of picture. So option B is out. Yes. Which also reminds me, if I can see option B is out, option C is also out. Because occipital lobe lesion, if it is there, there will be problem with visuospatial capacity. Visual, it's out. Okay. So we are left with option A and D. Yes. इतने में ही हो गया elimination. Next. Arithmetic borderline. It's okay. Okay. Symbol search is very low. Symbol search measures processing speed. So now we have two, which is more significant. We have similarities being low, symbol search being very low. Similarities, verbal comprehension. Also, along with Wernicke's understands, helps us understand what is being said, but our frontal lobe comprehends it and makes us respond. Frontal lobe damage. Now the question should be, okay, now we understood what is frontal lobe damage. Processing speed is also, yes, it is higher order functioning, absolutely involved in similarities. So if symbol search, which is processing speed and similarities, is very low, that means frontal lobe is there, clear. So A and B. But a bifrontal damage, bilateral prefrontal damage will not make you have a good block design. Have you all done block design properly? Have you ever seen how block designs are supposed to do? It's giving us an information that block design is average. If there is bilateral prefrontal damage, that means you wouldn't be able to make sense of the design and do it in time for it to have an average score. And if it is a deficit in across all domains, which it is not, then with your recall of understanding of neuropsych and your elimination, the answer comes as A. It is a confusing question. I get it. A and D seem very, very plausible. Are you guys with me? Okay. Did you understand how to approach this? This is not a straightforward question. And this is a little tough. Also, this is the question that is taken from CIP paper. This is not a random question that I have made up. This is a question from 2014 MPHIL paper of CIP. Okay. My point of showing this to you is not to scare you. For me to show this to you is that you have the answer. Maybe it is not right there, but you can come to a conclusion. It just needs a little bit of problem solving. How do you guys feel about this question? Quick. Do you think that you will be better able to approach such questions going forward? Thank you. Even if you don't have so much of information, try to get the elements that you think you know of. Always remember, again, I'm telling this, it's either recognition, recall, or elimination. Use one of this. If you cannot recall, skip. You can't recognize, skip, go for elimination and do it with all the information that you can recall about. Okay? Now, the first question that I asked when this question was actually popped up was, why are we using intelligence test for TBI? No one asked me that question. Thank you, Arima. Exactly. I completely, and this is something where the memorization will not be affected too much for you. That's where the overwhelmingness comes down. When you start linking topics together that you've studied, you will not have to overwhelm yourself with a lot of ratta marufying where it doesn't make sense. Like there's no conceptual clarity. That's why conceptualization is important. Please remember, for any neuropsych assessment, the first assessment that is done clinically is intelligence. I'll give you another one. BKT can also be used as an intelligence as well as a neuropsych assessment, which is done in MPHIL. Because BKT can also have all the functions neuropsychologically assessed. Your parietal lobe damage, your memory, your attention, your processing speed, your vocabulary. Can you like remember all the items flashing in your head about BKT? All of your master students, I'm assuming, so you might have at least read through some of the items of BKT. If not done it, yes, no. Okay. Why am I saying this is because maybe this question can be tweaked with any of the BKT items. You will still be able to answer it. Okay. So they might not ask a straightforward question. They will go like that and ask. And they will try to confuse you. Okay. So whatever information you have, take it, derive to a conclusion. Let's take another one. The last. Have you read it? Have you read the question? Have you seen the options? The next thing, my next question. How many of you know what are perseverative errors? Okay, write down what are perseverative errors. Write down for people who are not sure. Help your folks out, help your colleagues, help your friends, help your peers. What is repetition? Rudrani, try to explain it a little bit. Giving same answers or similar answers for different questions is called perseveration. Okay. What are perseverative errors? Same mistake over and over and over again. Okay. Is it possible for you to not know what are perseverative errors? Is it possible? It could be also possible कि अरे यार किधर तो पढ़ा है, याद नहीं आ रहा मैंने पढ़ा है, I know it but I don't remember it. पढ़ा है बट याद ही नहीं आ रहा यार, लिखना चाहिए था, फ्लैश कार्ड बनाना चाहिए था. नहीं है टाइम तुम लोग के पास बहुत सारी चीजें पढ़ने को, मत करो फ्लैश कार्ड्स. Simple. Now in this question what can we see? It's WCST. Do you know what WCST is? This would be my next thing to look for. Do I know what WCST is? Okay, I know that it's a neuropsych assessment. Wisconsin card sorting test. इतना मुझे पता है, ठीक है. अभी my favorite thing. What does it measure? What does Wisconsin card sorting test measure? Do I know that? मुझे बस पता है कि कुछ तो है, some test is there. Frontal lobe function. Okay. But what function is it measuring? It measures a function called set shifting. Okay. Now let me quickly explain what set shifting is. After a point of time, the card deck changes. And if a person is not able to keep up with the shift in the card that has been drawn, that means that person is doing errors over and over and over again. Yes? I'm making it extremely simple. हमको नहीं करना है confuse. Wisconsin card sorting test. There is some random card sorting test. अभी card sorting test में अगर errors हो रहे, that means the person is not able to sort the card. Forget about even seeing it. ठीक है? If someone is not able to shift the card, but card देख पा रहा है, so that means occipital तो नहीं हो सकता. Out? Yes? Cerebellum भी नहीं हो सकता. ठीक है, out. Done. बचे दो. Parietal lobe and DLPFC. Okay. Can you possibly understand that there are two ways of then approaching this? Either I know what a perseverative error is, or I'll have to go brain region wise. If it is card and sorting, that means I have to understand it and process it. If I'm processing it, then it is most likely a frontal lobe function. Again, there is a high chance you might not know what the test is. But the most likely answer can be selected. If there are errors happening, it is not that कुछ motor sort of an issue है. It is not cerebellum गया. अगर दिख पा रहा है तो occipital lobe गया, visual functioning intact है. Parietal and dorsolateral में ही कोई answer होना चाहिए. You take a guess. Another thing. Previous question had a lot of information. This question is a one-line question. Did you see the difference also? So sometimes you can work with a lot of information. And sometimes you'll have questions like this, where then you take a call. So अगर कुछ नहीं हो रहा पढ़ाई करने को with respect to psychological assessments के at least नाम figure out कर लो. लाइक WCST का अगर फुल फॉर्म भी पता चल गया ना, तो कार्ड सॉर्टिंग टेस्ट है, कार्ड से कुछ तो सॉर्ट करना है हमको, राइट? तो अगर कार्ड में कुछ सॉर्टिंग करना है, कैटेगरीज बनाने हैं, कार्ड को सॉर्ट करना है, माय एग्जीक्यूटिव फंक्शन हैज टू वर्क. सिंपल? Not really. It can get sometimes difficult. Okay. The more you ask questions to yourself beyond just rote memorizing the functions, it will be better for you, because it won't be humanly possible for you to keep memorizing this. I am shifting, जैसे मैंने कहा था, I'm shifting the way you're approaching questions for assessments right now. Did you see and approach questions like this before? Or is this the first time? Use your chat, use symbols, anything. Is this the first time you are coming across such a method? Okay, good. It's a good revision for you, Rudrani, then. This is the way you will approach assessments. Again, like I said, please remember these 3 strategies. See the whole picture, what does it measure, and try studying it together. Do not study in isolation. You will have difficulties in remembering. Your disorders, your theories, your assessments have to be studied together. You cannot read it separately. Your neuropsych, your intelligence, your ADHD, clinical disorders, everything is going to be mushed up. It's not even mushed up. That is how the presentation of a clinical disorder is. So when you, for example, pick up your ICD and go to neurotic and stress related disorders, please read it together. Your understanding of stress disorders, anxiety, along with how it is measured and how it can be seen in certain tests. Similarly, with hyperkinetic disorder, infamously hyperkinetic disorder known as ADHD, in your ICD. See it together, read it together, because it's supposed to be understood together also. एक दिन एंजाइटी पढ़ लिया, उसके बाद डिप्रेशन पढ़ लिया, फिर एडीएचडी पढ़ लिया, फिर एमआर पढ़ लिया, ये हो गया, ओके नेक्स्ट साइकेट्री, अहूजा, सब्सटेंस पढ़ लिया, ये हो गया, वो हो गया, अच्छा नेक्स्ट असेसमेंट. कितना बाइफर्केटेड स्टडिंग है ये, ऐसे तो कभी कंप्लीट नहीं होने वाला फिर. ओके, these are small things that you can do to make your life a little bit easier while prepping and approaching any question going forward. Thank you, Rudrani. That really helps. And we are open for questions. We are done. Ask me questions, drop in your questions. What do you have to ask? Anything. Did you understand the presentation? We'll come to that, Shambhavi. Did you understand the presentation? How was it? Was it too fast? Thank you, Sarah. Okay. Can we all see the picture span question together once more? Where did it go? This one, right? Okay. Thank you. Thank you. Okay. Shambhavi, do you mind unmuting your mic? Ritakshi, I'll come to you for that. Give me a minute once I'm done with Shambhavi's question. Shambhavi, can you please unmute your mic and ask me the confusion?
Okay, so for WISC 5, I was confused between coding and picture span because when we look at coding, right, it's obviously, like you said, multiple functions: speed, working memory, processing, hand-eye coordination, the
Hmm.
lot. But with picture span, the reason that I got confused was because it's also a task that gets progressively more difficult, more images to retain in your mind, and sometimes the images in the previous slide and the next slide are very similar. So the
Hmm.
order of those images also matters. And
Hmm.
in my experience, at least, like working with children, what tends to happen is that the inattention happens in even how much attention they are paying to the page. Like, are they even looking at the symbols correctly?
Hmm.
And sometimes they'll just fudge up the whole symbol order because they looked at it and for them it was too similar to what they saw last time. So they'll just be like, they'll just go ahead and mumble jumble all of it all. So that's where my confusion was, like maybe from my like practical experience intervening with how to logically reason through this. But if you could just go over that again, that would be helpful. Thank you.
Most definitely. First of all, your answer is correct. Okay. Firstly, that's why I have marked both. Your picture span and your coding will be affected when it is inattention with respect to ADHD. Now, why is coding as an answer right? And why would even I go ahead and select coding as an answer? Is first of all, what is most likely to be impaired? So, for example, when you take 10 kids who have ADHD, possibility of ADHD, almost everyone will make errors in coding. Whereas with picture span, there is a 50-50 chance or some percentile who might actually go and do it correctly as well. Some of them, at least. With coding, there are a lot of different parameters that is like assessed. Your right, your errors, and your chances, the missed ones which are correct, right? So a lot of stimuli coming together in that coding sheet will have a lot more inattention being captured as compared to picture span, which has certain number of cards. This is a little more qualitative understanding that I'm bringing in, which might not be, uh, I don't know, written somewhere as such. Okay. So when we talk about inattention, we have to have an understanding that yes, both will be affected, but what is most likely to be impaired? And also, children with ADHD can have a little better, like a little bit leeway with visual memory as compared to everything that is there in that one sheet, and they have to like concentrate on that and mark it right then and there in that one sheet. That's why it is the most impaired. I hope I answered your question. Thank you, Arima. Arima's contribution to your doubt also fits correctly. Shambhavi, is your question answered?
Yep. Thank you. Makes
You're
sense.
most welcome. Going to Ritakshi's question, how do we study Rorschach along with the disorders? I have some papers. I will share it with Shannon. He can help you out with that. Secondly, um, another thing with Rorschach is try to, again, you might not remember everything, but you have to understand what some responses indicate. When it is color, how does the psychopathology of mania work, of assessing colors? Because they are euphoric. When you're euphoric at that point of time, or when you have heightened emotions and more happy emotions and you are in a state of mania, you will attract colors a lot more. So you will see that patients with bipolarity active phase of mania, or who are in manic episode currently, or psychotic manic episode, they will even put colors in achromatic cards. So certain aspects of psychopathology has to be known for you to understand and guess how the Rorschach responses could look like. Does that answer your question, Ritaksh? Any questions, suggestions, feedback, anything? Because I have another 2-3 minutes. Did this help you to approach psychological assessments better? Give me a thumbs up, something. Okay, great. Good. Now, coming to everything that you said earlier, I'm going to read all the messages in the beginning. Rather, now can you answer this question for me? Answer this question now. Hopeful. Okay. Thank you, Khushi. That's such a nice. Excited, looking forward. Thank you. This was my hope for you guys also, that by the end of 1 hour, you don't feel overwhelmed. How do we know possible psychopathology behind the responses? There are a lot of papers, articles that you can read. There are some very obvious sort of, like, for example, movement and color responses. If there are more, that means it goes into mood disorders, some of the personality disorders as well. Less confusing and scary. I will find Rorschach and psychopathology. I have some papers. As soon as I find it, I'm going to send it to Shannon. Shannon, please share it with the students. Yes. Okay. Most definitely. Are you guys done with today's lectures, or do you have more? Thank you. Thank you. I'm glad. Done. Okay. Please go have your Sunday lunch. All the very, very, very best for examinations. Please approach this examinations as learning. Your capacity as a therapist is not assessed by this examination. It is consider it as a fellowship, as a specialization for you. But I also know a lot of MPHIL graduates who are not good therapists. So do not equate both for yourself. It is tough. Hard work and luck goes together. So I hope everyone gets institutes that they look for, but also do not concise your reach for universities. Okay. And next year MA होगा, तो next year भी दे सकते हैं. Yeah. Okay. So it's completely fine. All the very, very best, and please do well. Last question. We have to study disorders assessment. What is a maybe resource? Honestly speaking, manuals would be the best resource for assessments. YouTube is a good resource for neuropsychological assessments and understanding. And yes, number of colleges and seats are doubled. Sorry, I'm just reading all the messages together. Titasa. Wow, that's a very nice name. Good resource for assessment, neuropsychological assessment. You can read the NIMHANS manual, or you can just search independent assessments online. Just put it in Google. You can use YouTube resources to understand what the test is. That's great. Second, Rorschach, there is Essentials of Psychological Assessment. There's a small booklet by Tara Rose that should be good for you. I will send that across. Shannon already has that. Shannon can send it across. Um, yes, Indian Journal of Psychiatry also has some clinical guidelines. So a lot of different ways. There is no one book. There will never be one book for MPhil prep. So completely let that assumption go. Google is your best resource. And YouTube. And whisk ways का काफी information है online. बहुत सारे information मिल जाएंगे online. Okay. Shannon, I am done.
Yes, thank you. Thank you so much for taking this. I'm sure that everyone has enjoyed this. Like, can we have the clap emoji, please? Because she really deserves it.
Clapping for you also to be open to mental shifts and perspectives. Thank you. Thank you. Thank
We
you.
will administer the Wisconsin for everyone. The Wisconsin cards on. We'll see.
It is tough. I struggle with it also. Administering it is my nightmare in reality. But
There's automated versions also, right? If I'm not mistaken.
also you need money for that, na Shannon?
That's a whole other discussion. I mean, why do you think I started a psychometric company?
Let us not go to money and organizations paying to get assessments done.
Hmm. Anyhow, coming back, thank you so much for doing this. I'm sure that everyone has loved this. Was very helpful. When I found it very helpful, there was like things I was also learning for the first time. After like prepping like neuropsych properly for the exams, I'm still learning new stuff over here. So thank you so much. That was very helpful. And yes, I would like to reiterate that these tests don't tell you that you are good at psych. They tell you that you're good at giving the test. So
Yes.
don't feel that okay, my life is over. So thank you so much, Raksha. We are going to end here.
Welcome.
Small note that if you would like to have solve more MCQs and stuff and look at the older lectures and stuff, you can definitely check out the SciMode platform where you have found the link, right? So yeah,
And
thank you so much.
Before everyone goes, I really have to say, I am so glad that you guys are prepping at this point of time. And this can be controversial, but I'm still going to do it because everyone who has done MPhil, who's preparing for MPhil, is geared to provide you information. I can only imagine how I would have felt if I had so much of resources. So don't get overwhelmed. Use it as and when required.
Yeah, stay away from those LinkedIn posts that mention like 70 books. There's no way anyone has read those.
So
it's unlikely for prep, at least in like 4 months. Yeah.
And like I said, just go with what you know, and that information can itself help you with one of those strategies. So all the best and take care. Stay in touch with Shannon, with me. I will try my level best to respond to messages, but
we'll do Mumbai stuff. Anyway, after monsoon.
After monsoon.
Yes.
Okay, bye-bye. Take care.
All the best. Take care. Have a good Sunday.
Bye.
Kushi, you can stop recording. Thank you so much for